Hello, and welcome to Beyond the Surface. The Healthcare Surfaces Institute was founded 9 years ago to examine a frequently overlooked foundational factor in the spread of HAIs. Over these years, we've gained valuable insight and effectively highlighted how surfaces and products can support and harbor microbes, along with the challenges healthcare professionals have encountered when attempting to clean and disinfect them. I'm Linda Lybert, the Executive Director of Healthcare Surfaces Institute. On our podcasts, we will interview healthcare experts, patients, thought leaders, researchers, and many others about the challenges we face in our ongoing battle to mitigate the spread of microbes that cause HAIs and solutions that are being introduced. Today, I would like to welcome Rodney Rohde. He is a global fellow, is an international recognized subject matter expert, and science communicator in the public health and medical laboratory space. He is a Regents Professor at Texas State University System, University Distinguished Professor and Chair for the Medical Laboratory Science Program in the College of Health Professions at Texas State University. He also serves as Associate Director for the Translational Health Research Center. Dr. Rohde is a global fellow of the Association of Clinical Scientists, and honorary professor of international studies. He is an ASCP board certified specialist in virology, microbiology, and molecular biology. Welcome, Rodney.
Thank you, Linda, for that introduction. Kind of wordy, no worries there. That just means I've been doing this for about 3 decades. And as you know, we've been working on this issue together for, I guess, 8 or 9 years now. So it's a joy to be here.
Yeah, it's been a long time. So one of the reasons why I wanted you to be one of our very first guests is because you and I have talked for a long time about the fact that microbes are the issue here. The goal is to kill the microbes, but we never talk about them. And a lot of people really have a high level concept. They call them germs. And in real life, we really need to have an understanding about them, what they're doing, how they're acting, and how to clean them.
Yeah, I think most people, in a sense, especially the lay public, are always going to think about, germs. Is this kind of, it all means the same thing. And and I know, and others that work in this space, they are not the same thing. So when you talk about germs in a scientific sense, you're really thinking about several categories of germs. And just to name them, we typically are thinking about bacteria, one of the more problematic types of organisms that can adhere to surfaces. But there's also viruses. A lot of people have heard about SARS-CoV-2 during the pandemic. That's a virus, or influenza, and there's many others. Or even a fungal agent. Perhaps you've heard of a mold, Candida aureus, which is one that is kind of showing up in healthcare settings. And then there's also, interestingly enough, some protozoans. These are things like malaria and even worm-like infections, which are helminthic organisms. In hospital settings, Linda, or healthcare settings, long-term settings, any kind of clinical settings, you're really talking mostly about bacteria, viruses, and fungal agents. Certainly those others play a factor in disease, but you're typically not thinking about, for example, a pinworm being a problem on a surface. It can be on a surface, but it's typically not adhering to a surface like the bacteria, the viruses, and the fungus do.
Yeah. And so one of the things about healthcare, well, about any, is we're dealing with people that are immune compromised. And so a lot of times the pathogens that you just talked about, viruses, et cetera, we who are not in healthcare settings could actually get over those pretty easily, right?
Yeah, for sure. I mean, in the general public, you could look this up for exact percentages, but in general, most people have fully competent immune systems. They can handle kind of the general exposure to pathogens and microbes. But the ones we really truly worry about, like you stated, are immunocompromised individuals. That can be anything from something as drastic as an autoimmune disorder like lupus, or an acquired immune deficiency like HIV, or even just a chronic disease like diabetes or COPD. And of course, the elderly and the very young, each spectrum of the age is also typically considered weaker against pathogens.
So they're more susceptible in a
Correct.
healthcare setting of acquiring any one of these infections.
Correct.
And so when we talk about these different microbes and pathogens, how do they move in a healthcare setting? Why are we so worried? Why can't we just wipe a surface off and have them be gone?
Yeah, great question. Very simple question, but it has a lot of complexity to it when you answer it. So, in general, and I say this all the time to friends and colleagues, microbes truly are everywhere. There's probably not a place on this planet that we haven't found microbes, including places like the thermal vents of the ocean, some of the highest peaks on mountains, in a variety of hot springs and severe conditions like cold. Microbes are way more efficient at adapting to environmental stress. So if you think about that, that's just in the general population of the earth. When you start bringing people together, and especially sick people, right? So if you're bringing people into a healthcare facility, again, we think hospital, we think parts of hospitals like operating rooms and ICUs. It can be anywhere, Linda. It can be the waiting room. It can be the bathrooms, of course. It can be clinics. I often tell people it could be a dialysis clinic. It could be your primary care physician. It could be any number of areas. And we're not going to really spend a lot of time on this podcast talking about community settings, but it could be your schools. It could be a dormitory. It could be a workout center. There's plenty of research around these areas. And so when you think about congregation of people coming into these sites, whether they're healthy or they're got an infection or something in between, they often are bringing those microbes into those locations and those surfaces. And then, of course, just the general population of workers and deliveries and equipment and reagents and supplies. I mean, almost any type of thing that's coming into a healthcare setting or a community setting can bring um, hitchhikers. And those hitchhikers are the microbes like bacteria, fungi, and viruses, and others possibly.
So we've talked about how they congregate and how when people are in any given area, they're acquiring or they're picking up these types of microbes and then they move. Are there other ways that microbes can move, like on food service carts and
Absolutely, right? Again, so if you use your imagination or just observation, I would encourage our audience sometimes that when you're sitting in a healthcare office waiting area or you're sitting with your loved one in an ICU, I do this all the time, and just watch and observe the things that are going on. Whether it's the food tray coming in, whether it's the flowers coming into the room, and more importantly, the different healthcare professionals, not just nurses, Linda, not just physicians, but anyone. It could be someone coming in to draw your blood, a phlebotomist. It could be a health educator coming in to explain the infection you have or the surgery you have. Anyone. Anyone can be bringing in these types of things. And then once they're there, Linda, once the microbes are there, which we'll probably get into shortly, is they can find an ability. This is natural to them. Microbes want to attach, they want to find a way to adhere to surfaces. That can be soft surfaces, that can be rough surfaces, that can be surfaces that have already been cleaned many times over and over again. So there's all these issues. And really, it is very difficult. It's a very difficult problem. And again, I know this is part of your mission and passion, and so mine as well, is finding ways to educate everyone, not just the professionals out there, but everyone, how critically important it is to think about microbial movement. One of the things I used to tell my mother, this was so my father, one of the stories I tell people is my father has actually suffered from MRSA over his kind of later life. He's still around, but it's something he deals with, probably acquired it through a knee replacement. And so one of the things I had to remind my mother about and my family was just because you go into a healthcare setting or any setting and it smells clean, it smells like lemon fresh, disinfectant, it's ordered, it looks fine. The professionals look clean and they look like they know what they're doing. Microbes do not show themselves to our naked eyes. One thing the general public doesn't often realize is it takes a microscopic view and sometimes an electron microscopic view for viruses to even begin to understand what's sitting there around you on a surface. That can be a little terrifying, but it's educational, and you really should approach surfaces as always being part of the living environment in a hospital or healthcare setting.
Yeah, definitely. I remember I was an advocate for a patient, and I was really shocked by what you talked about, the movement of people and how they actually take care of the patient. And what was interesting is I saw things like the bedding fell onto the floor.
Right,
So they pulled the bedding up and just put it on the patient, or she dropped the nurse call button on the floor and they picked it up and handed it to the patient. And then the cell phone use was also
right,
interesting.
right.
Um,
When I did my, it's been years ago, and I think I've shared this with you before. When I did my PhD, the focus was on patient understanding and adaptation to MRSA, which is an antibiotic resistant bacteria. And the very thing you're telling me was in so many stories. It's also been something I've experienced. Let me start with saying I have nothing but the utmost respect for all healthcare professionals. They are trying to do their best. Things get crazy, things get busy, time is of the essence. But sometimes, even in my own experience, I would see even things like an IV tubing fall to the floor and that be picked back up. And, because of who I am, I would speak up and say, no, 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 we're not using that anymore. We're getting a new one.
yeah,
Right. So even as a regular old person that's ending up in a healthcare setting, do not ever be afraid to speak up and ask those questions or point things out, including hand hygiene, washing your hands and things like that. It's really critically important to your healthcare.
yeah, it definitely is. So now that we've scared people, and I've given presentations before, as well, where the audience is sitting there, kind of big eyes and their mouth open. What are some of the things that need to be addressed? So, the selection of surfaces, for instance, the goal of the surfaces being selected should be one that is easy to clean and disinfect. And, I always talk about the brushed stainless steel handrails that are out there.
Right.
Well, when you brush stainless steel, you've already created a microbial reservoir. So could we talk a little bit about how microbes attach and how they
Yes.
eat for that?
Yes. One of my favorite things to talk about, and I know it's yours as well. And I know you've educated yourself so well over the last decade or so looking into this issue. It's a passion of yours. And so it's a great, kind of blend between microbiology and the surface and the selection of surfaces. I'm going to mention to the audience here real quickly that I'm not an interior designer or anyone that's an expert on surfaces, but I've learned a lot in this particular collaboration with Linda and others. And so the idea is that microbes are built. They are engineered genetically to want to attach to something, almost every type, whether it's bacteria, fungus, virus, what have you. And they do that first through kind of this random motion. Whether it's just being moved around or it could be air kind of conditions or whatever, what allows a microbe to get on a surface, someone touching a surface. There's this kind of moment where there's kind of a reversible, it's called reversible attachment. There's a moment where the bacteria or the virus, or let's just say whatever microbe it is kind of figuring out where it's at. And by doing that, when I say that, it literally does environmentally sense what's going on around it. So there's this initial thing, and I'm going to give you a couple of scientific terms here just because we need to. Something like a bacterium might have they have a couple of types of appendages. So if this is a bacteria, my fist, and remember it's microscopic, they might have a flagella that's sticking off of it that helps them move through the surface. You could think of a tadpole, a more bigger view of that. Or it might be covered all around it with something called pili, Pili. You can think of these as tiny little hairs that are sticky, and they are basically going to create this foothold. I often tell people think of an anchor. It's almost like a suction cup that sticks to that surface. And that's the initial issue. If that happens, which it will in most cases, then we'll move on into future podcasts I know where we talk about biofilm and things like that. But ultimately, that attachment is so critical because once it happens, therein lies the problem. Then the bacteria, the virus, the fungus can start reproducing. They can grow colonies, populations of themselves, and then they can be transported much easily around the healthcare facility.
Clean the surfaces. Aren't we removing the pathogens?
Sometimes, right? So again, it's a complex answer because some disinfectants, some chemicals, some antiseptics, if you're thinking about human surfaces and things like that, do a pretty decent job in many cases, but it only takes a small amount to be left behind. And there's a lot of complexity around this that I know we'll continue to talk about. Sometimes if the wrong disinfectant's chosen or the surface is damaged from that chemical or from a physical process like brushing or something, as you mentioned earlier, you're actually creating more problems because imagine in your eye, your mind's eye, if you had this beautiful stainless steel surface like you mentioned, or a tile, whatever it is, and someone's continuously cleaning that and creating micro abrasions, little, looks like little trenches in a garden, right? And the seeds that are falling on that are bacteria or fungus or whatever we're thinking about. And then now we have, in many instances, trench warfare because those microbes kind of get stuck in those areas, in those kind of concave or indentured areas, and now you've got a real problem. And you may have to clean it. It's almost like you'd have to clean it continuously and beat that surface to death to be of any effect. And as you know, in any setting, it's going to be difficult to do that continuously all the time. It's going to be sometimes sitting there. It's going to be problematic.
Yeah, and we talk a lot about areas such as ICU that are cleaned repetitively, transplant units, things
Right.
like that, that need to be cleaned nonstop. And when I say nonstop, I mean quite literally, when someone comes to the room, they have to clean up after themselves when they
Right.
leave to remove.
Certainly, but certainly between patients, which we know is also an issue, right? I mean, a lot of research, I mean, most data will tell you, and you know this, I know, but if you have a patient in a particular room, whether it's an ICU or a regular room or wherever, and they are C. diff positive, which is a really nasty bacterium, Clostridium difficile, they may shed a certain number of bacteria and endospores in that room. And so if someone doesn't get that room clean, microbially clean, the next patient has a much higher risk of acquiring that particular pathogen. So that is really problematic and more of what you started with earlier to define excuse me, back up, a healthcare associated infection, which is an HAI.
Yeah. And the other piece of that is once you acquire one of these infections, many times it can alter your entire life, such as MRSA, where it's a pathogen that is multi-drug resistant
Right.
and you just have no choice. So it's really important that we understand the different environments that we're working in and the microbes that we are dealing with. And then how do we really get them clean?
I mean, it really takes us back to that long ago quote, right? An ounce of prevention is worth a pound of cure. If you can prevent those infections by, by all the way back, which you talked about, thinking about the hospital environment and the surfaces that you build with or repurpose with or upgrade with, you might be saving lives in some sense because you're creating a better environment that you can clean or take care of and maybe even be in some way you might even be able to select surfaces that are more anti growth, like you might even find types of materials that are a little more resistant to microbial attachment and things like that.
Yeah, and that's one of the things we always talk about. We need to build our facilities to be cleaned. In
Absolutely.
particular, any given type of environment where there are high traffic, high contamination areas, where there's such as an emergency room, where they're going to come into the emergency room, a lot of times bringing community-based illnesses or pathogens in, and then they're going to move from that area throughout the hospital during their care. And so, how do we build an environment that we can actually clean and disinfect effectively or fairly easily? And you and I both know it's a very complex discussion around what does that mean?
Yeah,
Um,
and I know you like to use the term. It's something I've used my almost my entire career about multimodal practices, right? Multimodal solutions. So you really do have to think about a multitude of factors. It can't just be, it's a people problem. We need to educate and build better EVS personnel. That's not always true. It may be the environment, or it's the patient's problem. We should be screening these guys and thinking about how we place them in the hospital. We need healthcare to work for everyone, and so it's really, you have to come at it from all angles, which I think is why this is such a difficult problem, as you know. And I'm preaching to the choir, but it really is thinking about how you're going to build that building, how you're going to select those surfaces. That's up front, and think about it within a foresight. Are those useful to be cleaned over and over again? Or maybe there's a shelf life, right, Linda? Maybe someone goes, maybe I'm just going to throw out, maybe every 2 years, we have to come in and actually replace those, because there's just so much you can do with the surface, and you're going to kind of beat it with that chemical or that physical process. And some things are probably not going to last forever. So you might need to repurpose surfaces or devices. We haven't really talked about devices, but even devices within the medical industry, so that you can clean those devices that are used in surgical techniques or other types of practices.
Yeah, I just sat in a webinar a few minutes ago that was about bringing new medical devices to the market. And not once did they talk about cleanability. Not once. They talked about FDA clearance. They talked about cost to them. I mean, and no one ever thought about the fact, and we run into this in our hospital facilities today, every day, is no one has looked at, can this product be effectively cleaned and disinfected? And what materials are we using? And the different seams on things.
Right.
It really, when you think microbial and you start developing something, that's where solutions really could be found.
Absolutely. Absolutely. I mean, it really takes microbiologists, infection preventionists, advocates. It takes interior designers. It takes engineers, and really some forward, thinking people with respect to infection prevention, because it is easy to kind of think you can clean these things or use them in a certain way, but if you stop for a moment and remember what we talked about here, how microbes have adapted for eternity on this planet. They will long outlast us, I promise you. They're everywhere, and they've been here forever. It's really kind of terrifying, and so you have to kind of think about it in that way. And I know one of the things I look forward to, I'll be an audience consumer of this podcast in the future, because you're going to have so many different experts coming on here that are in these realms that we're talking about, whether it's an engineer or an interior designer or even a construction professional that might be talking about these topics.
Yeah, definitely. And quickly, to kind of end this podcast, tell me just briefly about multi-drug resistant, because there are some microbes now that
Yes.
are dangerous.
Yes, very. And again, this could be a multiple podcast type of conversation, but let's set this up for some future conversation as well. So you might see an acronym out there, MDRO, which is multiple drug resistant organisms. You also will see an acronym AMR, which is antimicrobial resistant. And so let's first state that can be across any bug. It can be a virus, it can be a bacterium, it could be a fungus, and in reality, they are out there, and they're growing, unfortunately, globally. And so microbes, again, they have developed so many mechanisms over time they can do things like transfer genes of resistance horizontally. We'll talk about this some in the biofilm podcast. And then the biofilm itself, when you have a big population of bacteria, for example, and they're living in a biofilm, you can have polymicrobial colonies. Now, you could have Staph aureus, you could have E. coli, you could have Enterococcus, Pseudomonas. You could have different bacteria that are sharing resistance genes. This is not fair. It would be, Linda, I always tell this to my students, it would be like me reaching into this screen and we touch and you have gray hair automatically because I can transfer my hair color immediately. It's not fair because bacteria do this constantly. And now let's back up and remember, where's this happening? Everywhere. I mean, if you have patients in the same room with different infections and you have opportunities for bacteria and viruses, fungus to interact in a biofilm, it's almost 100% going to occur. And so this is a global problem. It's an ongoing issue. It's one that's, again, something I've worked my entire career on talking about. There are estimates that by 2050, this could impact so many people globally that it may become the #1 killer of people, surpassing cancer. That should scare you. And it's something we can all think about and help do better on.
Definitely. All right. Well, it has been a pleasure. People always talk about the scientific side and, oh, that's too sciencey. We have to talk about it because it is the bottom line.
We do. And as you know, I think we both are passionate about, science communication. It's a problem globally right now, whether we're talking about a pandemic or whether we're talking about something right here in your own doctor's office. So it's something you don't have to become an expert, but you certainly want to educate yourself around these topics.
Yes, definitely. Well, thank you so much for joining us, and I look forward to future podcasts as we further discuss this ongoing issue.
Thanks so much, Linda. I look forward to the next one.
Thank you for listening to Beyond the Surface. This podcast is brought to you by ISSA, the Worldwide Cleaning and Facility Solutions Association. Please subscribe and write a review for us on whatever platform you enjoyed this podcast on. For more information, go to healthcaresurfacesinstitute.org.